You know, West Virginia Health Rate's mission is to serve the underserved and try to find gaps in care. So it's been a desire of mine, as you know, being at Health Rate since 1997, to bring something to the West Side. We know it's long been overlooked, and they needed a walkable clinic, but we wanted to make sure that that had health equity and was well thought out. So it really came to fruition when I was able to hire Shayla Leftwich. She's the West Side site coordinator.
We are in one of the most diverse neighborhoods and one of the most diverse cities in the state. So making sure that we were making a comfortable, welcoming environment for the people that lived here was really, really important to us. So we started with the clinic, and as we added on to the Wellness Center, we wanted to add things that supported overall wellness, not just medicine.
Of course, the clinic is a full-range clinic, labs, you know, we have an expanded behavioral health space, we have licensed professional counselors, we have recovery coaches on site. We have community partners like a domestic violence worker here. We have somebody from the state to help people sign up for, you know, housing assistance and Medicaid. We have a place for kids to have short-term daycare while their parents are in an education class or they're having a female exam or whatever they need, because we know child care is a big obstacle for people. We have a great teaching kitchen. It's just amazing with individual cook stations. Shayla was really conscientious about that. So people can actually come in. You're not just giving people a prescription for medications and telling them to do this and telling them to do that. This is where they can actually learn. Here's the foods you bring in. This is the recipes you can make. This is how you can lose weight. This is how you can control your diabetes. Something I was also adamant about was a free gym space. We tell people all the time, you need to exercise, you need to do this, you need to do that. Well, people know in West Virginia it's hard. Some people on rural routes where there's not walkable, safe space. Down here it's hard as well. You can't tell somebody go exercise and expect people on a fixed income to go out and join a gym. So we have a gym here. We have a huge activity room. I was adamant about the fact that I wanted mirrors and ballet bars. I wanted to make sure that the children in the neighborhood had the same opportunities that everybody else have, that they had an opportunity to have ballet and jazz and tap classes. You know, we get to connect with the parents, which is more importantly. They may not have a real trust of the healthcare system, and we know why historically, but they may bring in their kid, and then we show, you know, we're here for the right reason, and then the next thing you know, maybe we're checking mom's blood pressure, and she's in the clinic next time, and we're helping, you know, fix some things that have been there long term. So this is all part of that human connection. Everything in terms of social determinants of health, there's something that addresses that here. The whole community wellness center is filled with things that there's no reimbursement for. We have, you know, a whole row of computers that people can come in and build their resume and job search and all of that. And then we have the assistance of people there to help them do, you know, mock-up interviews and get ready for that. And then once they've got that interview lined out, we have the career closet, the Unity closet. I just call it a career closet because it gets people prepped and ready. That's an area, the economic impact that we really want to build on here. You know, if we can get additional funding, we have such big ideas on how we can help support this community.
Right away, Angie had this idea. She says, we need to put up a mural. We need a mural. We need something that really, really showcases, you know, the unity part of community wellness. So we found an artist, and he created this mural of a garden scene with 3 children playing together, planting seeds, growing flowers. It's so beautiful. It really just shows the unity that we're striving for all the time, because we are so much stronger when we work together.
It just took off. I mean, people saw that our hearts were in the right place. They saw that list of needs that the community gave us that they wanted. And slowly but surely, from one-time donations from different orgs and entities and managed care organizations, et cetera, we were able to just tick off that list.
People that were afraid to come to the doctor, that are now not only coming into the doctor, they're coming into the cooking class, they're coming to Lucy's wellness class, they're now doing smoking cessation, they're in recovery. All these things happen because what we're doing is genuine, it's from the heart, because we have data to prove that it's working. Because every single day somebody thanks me. The reason it's easy to see the passion is because this is real and it's working, and you cannot fake that.